Why are UK citizens embracing medical tourism? The Lost Executive. An article by Donnie Rust, narrated by Mitchel Douglas-Green. For those unfamiliar with the term, medical tourism involves travelling across international borders to receive medical care, and it has been on the rise globally. For residents of the United Kingdom, the trend is growing at an accelerated pace as more and more Brits seek surgical treatments abroad. Whether driven by long NHS waiting lists, the desire for specialised care, or the prospect of cost savings, the decision to go overseas for medical procedures is becoming an attractive option for thousands. The Lost Executive explores the motivations behind the popularity, the countries benefiting from British medical tourists, and the potential risks and rewards involved. Delving into the what. Medical tourism involves patients travelling to another country to access healthcare services, which can include dental work, cosmetic surgery, orthopedic surgery, and even organ transplants. Historically, the term referred to people from less developed nations seeking advanced healthcare in wealthier countries. However, today, many patients from developed countries like the UK are opting for medical procedures abroad that appear to offer the same, if not higher, levels of treatment for a fraction of the cost. Dr. A. Smith, a consultant surgeon, explains, "The idea of medical tourism has shifted from being solely about affordability to encompassing better access to specialised care. Many countries now offer high-quality services that match or even surpass what's available domestically, and patients are increasingly recognising that." The growth of UK medical tourism. Recent studies suggest that the number of Brits travelling abroad for surgery has increased by around 15 to 20% over the last 5 years. A report by the International Medical Travel Journal, IMTJ, found that approximately 63,000 UK residents travelled abroad for medical care in 2023 alone. The reasons for this surge vary. However, long waiting times in the NHS for non-emergency surgeries, such as hip replacements, knee surgeries, and cosmetic procedures have been significant contributors. According to the UK's National Health Service, the average waiting time for elective surgery is between 18 to 24 months. For many, this delay is untenable and unfair. A 47-year-old patient, Charlotte Davies, who travelled to Hungary for a hip replacement, shared her experience. "I just couldn't bear the wait any longer. The pain was constant, and when I found out that I could get the surgery done within a month in Budapest at half the price, it felt like an obvious choice." Countries popular with UK medical tourists. Several countries have emerged as top destinations for UK medical tourists. The most popular are Turkey, Hungary, Spain, and Poland, each offering competitive pricing and high standards of care. Turkey is arguably the most favoured destination for cosmetic and dental surgeries. Istanbul has developed a reputation for hair transplants, with clinics catering almost exclusively to foreign clientele. For instance, the average cost of a hair transplant in Turkey is around £1,500, compared to £6,000 in the UK. Dr. Emre Kaya, a Turkish cosmetic surgeon, states, "We have seen a huge influx of British patients, especially for procedures like rhinoplasty and hair transplants. Our clinics offer modern techniques and high success rates, all at a fraction of the cost." Hungary, known as the dental capital of Europe, Hungary attracts thousands of British patients for dental implants, crowns, and bridges. Dental treatment in the UK can be prohibitively expensive, with some patients reporting savings of up to 70% when opting for treatment abroad. Hungarian clinics, particularly in cities like Budapest, are known for their cutting-edge technology and English-speaking staff. Spain is a popular choice for UK citizens seeking orthopedic surgery, like hip and knee replacements. Private hospitals in Spain offer advanced care, with no waiting times and comprehensive aftercare, appealing particularly to older patients who need immediate intervention. Poland is becoming a popular destination for bariatric surgery, with procedures like gastric bypass or sleeve gastrectomy costing between £3,000 and £5,000, far below the average UK price of £9,000 to £15,000. The cost factor. One of the most significant driving forces behind UK citizens opting for surgery abroad is cost. In many cases, treatments can be up to 70% cheaper than in the UK. For those without private health insurance, paying out of pocket for surgery in the UK can be financially draining. For example, a typical hip replacement in the UK might cost around £12,000 to £15,000 in a private hospital. In comparison, the same surgery in India or Eastern Europe can be as low as £5,000, including accommodation and post-operative care. British expat and medical tourist Simon Tucker, who underwent knee surgery in Poland, remarked, "I was looking at either paying a fortune to go private in the UK or waiting 2 years on the NHS. The Polish clinic had excellent reviews, and even with flights and hotel stays, I saved over £6,000. Quality of care. A common concern among medical tourists is the quality of care abroad. While cost savings are attractive, many patients worry about the standards of treatment in foreign clinics. However, countries that cater to international patients are often accredited by international healthcare organisations and subject to strict regulations. The Joint Commission International, JCI, and the International Organization for Standardization, ISO, are two bodies that certify hospitals and clinics for their quality of care. According to Dr. Hannah Reid, a healthcare consultant, patients should always look for JCI-accredited facilities when considering treatment abroad. This ensures that the hospital adheres to global standards of care and patient safety. In many cases, the quality of care in these countries can be equal to or even surpass that of UK facilities. Surgeons and medical professionals in popular medical tourism destinations often receive their training in Western countries, including the United States, the United Kingdom, and Germany. The risks and challenges. However, while medical tourism can offer benefits, it is not without risks. One of the primary concerns is the possibility of complications arising after surgery. Post-operative care is crucial for recovery, and patients who have undergone surgery abroad may find it challenging to access follow-up care once they return home. NHS policy, for example, does not cover complications from procedures done abroad, meaning patients may need to pay for corrective surgery. Another issue is travel. Depending on the type of surgery, flying soon after a procedure can increase the risk of deep vein thrombosis, DVT, or other complications. The British Medical Journal, BMJ, advises patients to wait for a specific period after surgery before travelling, typically between 1 to 6 weeks, depending on the procedure. Additionally, there is the issue of legal recourse. In the UK, patients have access to regulatory bodies like the General Medical Council, GMC, and the Care Quality Commission, CQC, which ensure that standards are met and allow for compensation in the event of malpractice. When seeking treatment abroad, patients may not have the same protections, and pursuing legal action across borders can be complex and costly. Is the industry a sign that the NHS has failed? The increase in UK residents seeking medical treatments abroad is often viewed as a symptom of deeper systemic issues within the NHS. While some argue that medical tourism offers choice and affordability, others believe it highlights the NHS's failure to meet certain healthcare demands. One key issue driving this trend is long waiting times, particularly for elective surgeries. Elective meaning those that are non-emergency and can be scheduled ahead of time. The pressure on the NHS, exacerbated by funding cuts and resource shortages, leaves many patients facing extended delays. Professor Johanna Heinfeld of the London School of Hygiene and Tropical Medicine notes that many UK residents feel failed by the system and are compelled to travel for more accessible or affordable care abroad. This sentiment is echoed by many in the healthcare field, who view medical tourism as an indication that the NHS cannot always provide timely or sufficient care. Moreover, professionals have pointed out that the NHS is not equipped to handle complications arising from surgeries performed overseas. Dr. Neil Lunt, a researcher at the University of York, emphasises that while patients may save money on initial treatments abroad, follow-up care within the UK for complications often places additional strain on NHS resources. This, he argues, is a direct consequence of patients being let down by domestic healthcare systems and taking risks to bypass long waits. Additionally, many patients feel that the NHS has lost their sense of direction and become a political entity, placing agendas ahead of actual patient care. As one patient who spoke with the Lost executive directly said, "Why would I trust a hospital system more interested in pushing marketing and non-scientific agendas than patient treatment?" On the other hand, some experts argue that the increase in medical tourism is not necessarily a failure of the NHS, but a reflection of the globalization of healthcare. According to a study published by the National Institute for Health and Care Research, medical tourism is becoming an unregulated industry, where aggressive marketing and price sensitivity drive patients to seek treatment abroad. This raises questions about the safety and ethical standards in destination countries, as highlighted by UK coroners investigating deaths related to surgeries abroad. A growing industry. Nevertheless, the medical tourism industry is showing no signs of slowing down. A 2024 report by Deloitte estimated that the global medical tourism market could exceed £100 billion by 2025, driven largely by patients from developed nations like the UK seeking affordable and timely healthcare abroad. Industry experts believe that the increase in medical tourism from the UK will continue, especially as the pressures on the NHS show little sign of abating. According to a study by YouGov, 45% of Brits said they would consider travelling abroad for medical treatment if it meant avoiding long waiting times, and 37% cited lower costs as a motivating factor. As medical tourism continues to expand, more patients will weigh the benefits of seeking healthcare abroad against the potential risks. With careful planning, research, and consideration of the destination's quality of care, medical tourism can be a viable option for those who are looking to bypass the hurdles of the UK healthcare system. In the words of healthcare expert Dr. Michael Davies, medical tourism isn't just about affordability anymore. It's about choice, accessibility, and receiving care on your own terms.